Mental illness was a very unknown topic back in the late 1800s to mid-1900s in the United Kingdom. Whittingham Mental Asylum was the biggest asylum in England, and many allegations about patient abuse were reported from this institution. Ansberger exchanged his invention, the electroencephalogram, for hope of the well-being of patients suffering with a mental disability. Whittingham was the first mental institution to put the electroencephalogram, or the EEG, into practice. It had completely changed the way patients were treated at Whittingham Hospital in 1931, only 3 years after the EEG was created. Eventually, it was used in most mental asylums, which held patients of mental illness all around the world. Because mental illness was such an unknown topic, people could be admitted for things as small as acting out of sorts. Irrational motives for people being admitted into the asylums could, but are not limited to, be nymphomania, abuse by husband or wife, excessive sexual abuse, and jealousy. Patients that could be suffering from small things like anxiety attacks or unusual behavior, which can be caused from sleep deprivation in childbirth, to infectious brain diseases, and post-traumatic stress disorder, or better known as PTSD. Sleep deprivation disorder can cause insomnia, anxiety, and obsessive-compulsive disorders, as childbirth postpartum can be a major cause of depression. Infectious diseases can cause permanent brain damage and brain abnormalities, as PTSD can also do, which can be seen in the picture shown here. During this time, there were no medically correct ways to diagnose if someone was legitimately ill with a mental disease or disability, and if people were admitted to a mental institution, no one knew ways to treat it that weren't harmful to the patient in the long run.
She's being unhappy like this. She's frightened, you see. She's frightened. Bless her. Even though I'm here, and she... Blackie. Should I try to open this? Let's try. Oh, yes. Come, Blackie. If she sees this, she'll be...
Lobotomies, trephination, insulin shock or coma therapy, electroconvulsive therapy, and fever therapy were very common ways of trying to treat mental illness during this time. Pyrotherapy, or fever therapy, is raising the body temperature and sustaining an elevated body temperature. This procedure was thought to have killed off bacterial infections, which may have stopped the bacteria from deteriorating the brain tissue even more. This treatment ranged from hot baths and towel wraps to extreme doses of radiation. Insulin shock therapy, or insulin coma therapy, ICT, was a form of psychiatric treatment in which patients were repeatedly injected with large doses of insulin in order to produce daily comas over several weeks. This would often create brain seizures in patients. Trephination, also known as trepanning or burr holing, is a surgical intervention where a hole is drilled, incised, where a hole is drilled, incised. I know it's a minimal, like it's not a full-blown seizure. It's to trigger the body to have the seizure, but then it's just that ECT is actually simulating something that occurs naturally in some people, from an anonymous interviewee. Many mental institutions' doctors and nurses were accused of physically abusing their patients while practicing some of these treatments. Reports varied from doctors locking their patients in their rooms or other small spaces and dragging them by their hair, to physically and sexually assaulting them and tying them to chairs for long periods of time. They would also perform wet towel treatments, which was when a doctor would tie a wet towel around a patient's neck until they became unconscious. Some allegations were even made about doctors setting patients on fire after dousing them in a flammable liquid. All of these accusations of patient abuse were reported in Whittingham Mental Asylum, leading reporters to dig deeper and put the accusations in the local newspaper. These stories of abuse encouraged the scientific community to explore new ways to diagnose and treat mental illness. Ansberger was a German inventor who was especially interested in the well-being of patients with mental illness because his younger sister suffered from schizophrenia. In the early 1900s, he began inventing the electroencephalogram, the EEG. The EEG was used to measure a person's brain activity to determine if they had irregularities in their brain. Today, the main mental disabilities that are determined by using an EEG are seizure disorders, inflammation of the brain tumors, memory problems, strokes, and various kinds of sleep disorders. Berger made the first recording using an EEG on July 6, 1924, during a neurosurgical operation on a 17-year-old boy. He had noticed the accusations from Whittingham in the newspaper and was later hopeful his invention would improve the well-being of people with potential disabilities. Institutions like Whittingham being the first mental institution to put the EEG into practice, were changing their methods of diagnosing their patients. The electroencephalogram changed the way patients at Whittingham Hospital were being treated in the beginning of 1931, just 3 years after the invention. Both scientists and the public, especially those who had mentally ill family members being mistreated, felt relief after hearing of this invention and the intentions brought with it. The spike in waves were described shortly thereafter by the American group of EEG pioneers, H&P Davies, F&E Gibbs, Lennox, and Jasper, although Berger had also observed them but considered them to be just artifacts. Although the use of the EEG changed how mentally ill patients were diagnosed and treated at Whittingham, it was still in its infancy. By the year 1920, the EEG was used in most mental asylums and began helping patients of mental illness all around the world. Fewer and fewer people were being admitted to asylums, and less were being brought in for testing. Because there was a great decrease in the amount of patients being admitted, doctors, psychologists, and psychiatrists had more time to research, evaluate, and properly diagnose their patients. Also, the allegations went down by a tremendous amount because the EEG successfully lightened the load of people by reducing the number of patients being admitted, and again, had more time to figure out the appropriate ways of treatment per patient.